Hello guys, welcome back to my channel which is Real Homeopathy. Please do like, share and subscribe to my channel, and for more updates stay tuned and press the like given below. So this is Pragathi. I did the HMS which is Homeopathy. I officially legally want to introduce myself to you all here, and today I thought I'll be explaining which is on abnormal uterine bleeding. So what is the definition of this abnormal uterine bleeding? So any uterine bleeding which is outside the normal volume, or it may be duration, or the regularity or the frequency is increased, then it is called as abnormal uterine bleeding. So what are the common causes here? So common causes of this is dysfunctional uterine bleeding is one first cause, and next one is the infection here, and endocrine dysfunction, pregnancy complications, hematological disorders and neoplastic growth. Okay, so patterns of this abnormal uterine bleeding. So there are 5 patterns. The first one we see is menorrhagia, polymenorrhea, metrorrhagia, oligomenorrhea and hypomenorrhea. We'll see one by one in section today. So what is menorrhagia here? So synonym to that is hypomenorrhea. So it is defined as cyclic bleeding at normal intervals. So the bleeding here is either excessive in amount, which is more than 80 milliliter, or it may be in duration more, which is more than for 7 days there is a bleeding. So the term menorrhagia is often used to denote prolonged bleeding. So the prolonged bleeding, for that there is a particular term which they call it as menorrhagia. So cause we'll see here. So it is a symptom of underlying pathology. If there is any pathology, then there is menorrhagia here. Organic, which is a pelvic or fibroid uterus. Adenomyosis is the second cause. So there is this organic, and in organic we'll see there is a pelvic is the first one. So in pelvic you'll see fibroid uterus, adenomyosis, pelvic endometriosis, IUCD intrauterine, contraceptive devices in utero, chronic turbo ovarian mass, tubercular endometriosis. Next, retroverted uterus, which is due to congestion, granules or cell tumor of the ovary. So this was a pelvic cause. Next one is endocrinal cause. We see there is hypothyroidism and hypothyroidism. Both hypo and hyperthyroidism comes here. Third one is hematological cause. So this is idiopathic thrombocytopenia purpura here. Next one is leukemia, von Willebrand disease, which I have explained in the previous lectures, and platelet deficiency here. And the fourth one is endocrinal upset, which is a function. So due to disturbed hypothalamo-pituitary-ovarian endometrial axis. So this is a axis which is hypothalamo-pituitary-ovarian endometrial axis, which is common causes of abnormal vaginal bleeding, includes all these organic causes here. So menorrhagia, we'll see the diagnosis of that, how to diagnose that clinically. So there is a long duration flow, passage of big clots is there, means then we can consider that, and use of increased number of thick sanitary pads, pallor and low level of hemoglobin gives idea of this diagnosing in a metrorrhagia here. Next we'll see about menorrhagia, so that was, next coming to polymenorrhea. What is the definition of polymenorrhea here? So it is a cyclic bleeding. It is a cyclic bleeding where the cycle is reduced to an arbitrary limit of less than 21 days. So it is associated with excessive and prolonged bleeding. So causes of this is dysfunction, which is seen in adolescence, preceding menopause and following delivery and abortion. Hyperstimulation of the ovary by pituitary hormones may be a responsible factor here. Next, ovarian hyperemia. As in pelvic inflammatory disease or ovary endometriosis, we see this. Next, coming to metrorrhagia, this is the second one we'll see here, dysfunctional uterine bleeding. So it is irregular, which is a cyclic bleeding from uterus. Metrorrhagia is a cyclic bleeding which is irregular Amount of bleed will be variable, it will not be a constant kind, it will be variable related to surface lesion in uterus. Menorrhagia is a term applied when bleeding is so irregular and excessive that menses cannot be identified at all. So this is known as menorrhagia. Next one we'll see causes of contact bleeding. Causes of the contact bleeding. There are certain 4 causes here. I'll be explaining you all right. And the causes of the contact bleeding, causes of cyclic bleeding, and causes of intermittent bleeding, and causes of oligomenorrhea. So causes of contact bleeding, which will be the first one, which is due to cervix and mucus polyp of cervix, vascular growth of cervix, especially during pregnancy, which is a pill use cervix. And next one is infections, chlamydia infections or tubercular cervicitis. Next one is cervical endometriosis. Next, coming to causes of cyclic bleeding. Dysfunctional uterine bleeding, usually it is seen during adolescence, following children and abortion, and preceding menopause. There is a submucous fibroid, which is a uterine polyp, CA cervix and endometrial cancer. Next, causes of intermittent bleeding, which is a urethral caruncle. Ovular bleeding is there. Breakthrough bleeding in pill use. Whenever there is a contraceptive pill use, there will be a breakthrough. And intrauterine contraceptive device in utero, decubitus ulcer. So in these cases, there will be causes of intermittent bleeding. Next, coming to causes of oligomenorrhea. Where you see this oligomenorrhea, what are the causes of that? It is age related, adolescence and preceding menopause. You will see in 2 cases here. You will see in adolescence and you will see in age who are preceding to menopause here. There is weight related thing, which is obesity. There is stress and exercise related, stress and exercise related, age related, weight related, endocrine disorders like PCOS, polycystic ovarian disease, hyperprolactinemia, hyperthyroidism. Next one, androgen producing tumor, which is ovarian tumor, adrenal tumor, tubercular endometritis, which is in the late cases. Next, coming to oligomenorrhea. What is the meaning of this? So it is which is a bleeding more than 35 days. Oligo means absence or less. Amenorrhea is absence. Oligo means there is a bleeding which is more than 35 days, completely like not regularly since. Hypomenorrhea, bleeding is unduly scanty and lasts for less than 2 days. Causes of that causes of this hypomenorrhea, you'll see it may be local like uterine syneche or endometrial tuberculosis or endocrinal, use of contraceptive pills, and thyroid oral use of oral contraceptives pills. And there is a thyroid dysfunction and pre-menopausal period, or there is a systemic cause which is malnutrition. So you see there is a local, endocrinal, systematic. So this was the explanation of that, and I'll say you what is the first one we have seen was menorrhagia here. Menorrhagia, polymenorrhea, metrorrhagia, oligomenorrhea and hypomenorrhea. So we have seen causes of contact bleeding, causes of acyclic bleeding, causes of intermittent bleeding, causes of oligomenorrhea. So, and we'll see even the homeopathic therapeutics here. So in homeopathic therapeutics for menorrhagia, there is iodine. So what does iodine do here? So endocrinal dysfunction, it is treated well. By this, any endocrinal infection, any endocrinal lesions are there, then by this item it is treated well in all the cases. So especially which is related to thyroid gland. So where synthesis of thyroxine is hampered, generally there is a uterine bleeding with enlarged and indurated uterus. With acute catarrh, where there is an acute catarrh of endometrium, the uterus where there is acute catarrh particularly to endometrium, then iodine is particularly indicated. And next, patient shows rapid metabolism and loss of flesh. There is rapid metabolism, loss of flesh with great appetite. There is great appetite, loss of flesh and rapid metabolism. The patient is hot and better by cold. Patient wants to move all the time. Symptoms relieved when the patient is busy or when she is busy particularly. Aggravation is warm, exertion, amelioration is eating, cold and movement. Coming to phosphorus is a second remedy. So it is used in pelvic inflammatory disease as chronic salpingo-uveitis. It's a case, and used in cases of chronic endometritis, usually tubercular in origin, or malignancy of genitourinary tract where it is affected. So this remedy, phosphorus, comes in role, and it is well treated by that. And coming to dysfunctional uterine bleeding and polycystic ovarian disease is treated well by this phosphorus remedy. So there is aggravation evening and left side, cold, amelioration warmth lying on right side. Let's come into metrorrhagia. What are the remedies in metrorrhagia here? So there is a plumbum met, second core. So I'll be saying you about the plumbum met here. So patients are of climacteric group here. Bleeding is profuse due to fibroids in the uterus, or it is bleeding that is due to systemic disturbance, systemic disease. Due to systemic disease, there is like hypertension, suppression of eruptions, okay, and progressive muscular atrophy. There is great vaginismus, usefulness, sclerotic conditions, hypertension due to atherosclerosis when it is marked. Atherosclerosis means there is a thickening of the arterial walls. So aggravation is when there is a moment, aggravation at night, amelioration by heart pressure. Heart pressure, there is amelioration. Next, coming to second core is the other remedy for metrorrhagia, and I think I have even explained this all in the previous classes where I was explaining you all about metrorrhagia, and you can see that link. If you haven't seen, then I'll be giving that link in my description. Kindly check it out. And the next remedy I'll be explaining about is the sickle core. Sickle core is profuse. There is a profuse bleeding, painless bleeding in the women of the climacteric age group. So motion aggravates complaints, and there is a passive hemorrhage, dark blood and scanty, and hemorrhage due to atony of uterus here. Severe anemic conditions where there is coldness, numbness and mortification with gangrene. Aggravation is heat and warmth, and when there is a covering of parts, then you see there is this remedy comes in a big help. Amelioration, there is a cold application, generally in cold, and rubbing extremities and pressure in abdomen. Other remedies comes like pulsatilla, second core, thalapsy, bursa pastoris, arsenic amalgam, and last one is a very interesting remedy which is Alteris farinosa, where you can just check this out, and in the next class I'll be explaining about this remedy. And yeah, this was it about the abnormal uterine bleeding. Here I have explained you about menorrhagia, metrorrhagia, oligomenorrhea, and causes all of that. So hypomenorrhea, polymenorrhea. So this was it. I just want to thank you all for watching the video till the end, and kindly like, share and subscribe to my channel. If you liked my video, then please give a thumb up so that I can be motivated to make more videos. Kindly stay tuned, press the bell icon given below.